Viral illnesses continuing to spread throughout Metro Detroit right now and continue to send lots of people to the doctor's office and even the hospital.
It's hard to keep track with everybody at work and school. It's a mess. So some local hospitals say they're starting to see cases of RSV in children drop off a little bit, but that's just one piece of the viral puzzle. Our Dr. Frank McGeorge is here with a look at what's going around. Doc.
Well, Karen and Jason, it appears that some hospitals have passed their peak of RSV cases, but RSV is far from over, and now flu is on the rise in Michigan as well. Here's what's going around where you live.
In Wayne County, Dr. Kevin Daisy at Children's Hospital says about 60 to 70% of the kids he's seeing have RSV. Ascension St. John is seeing fewer patients with RSV, but more influenza, strep throat, and pneumonia. Henry Ford Hospital and Trinity Health Livonia are both seeing more flu and COVID. Stomach viruses round out the list. Moving to Oakland County, Corewell Health Beaumont-Troy is still treating children with RSV and other upper respiratory viruses, plus an increase in the flu. The ER at Henry Ford West Bloomfield is seeing lots of flu symptoms and COVID cases. And Henry Ford Dr. Rena Dazia reports a ton of patients with adenovirus this week. That's turning into bronchitis. At the CVS mini clinics, strep throat is on the rise. Looking at Washtenaw County, Michigan Medicine reports lots of children with RSV and other respiratory illnesses, plus continued COVID and some flu. In adults, Dr. Brad Uren is also seeing lots of upper respiratory infections, including COVID and RSV and some stomach viruses. The health department reports flu cases are rising in Washtenaw County, along with flu hospitalizations. Heading to Monroe County, ProMedica Monroe Regional is still seeing an uptick in RSV, with most cases in children, but some in adults too. Doctors say COVID levels remain moderate, but they're treating more cases of the flu this week. Checking on Macomb County, Dr. Anthony Joslin at McLaren Macomb says RSV continues to be the most common diagnosis in the emergency department. Stomach viruses and COVID cases remain steady. At the CVS mini clinics, bronchitis and flu are the top concerns. Finally, in Livingston County, doctors at Chelsea Hospital continue to treat a number of children with RSV. They're also seeing an increase in the flu and COVID this week.
Now, if you get the impression that we're seeing a lot of illnesses locally, you are correct, and we expect that the flu is only going to get worse in the coming weeks. So if you have not had your flu shot, you need to get one as soon as possible.
Oh, yeah.
You got flu, RSV. I'm hearing of adenoviruses. What's that all about?
So adenoviruses are actually kind of interesting because they can cause a wide range of illnesses, from the common cold to gastroenteritis. Now, we do not routinely test for adenoviruses by themselves, but as more people are getting viral screenings, we are seeing more of those right now popping up on these big panels that we do.
Because we just need to add more to the list.
You read my mind. That's all we need is one more thing. Yeah. Thanks, Doc.
A massive